implants, and we've had several people. Now I don't know how widespread this is, but we've had several people who have been completely devastated because of the artificial implants they had in their nose, in the bridge, to build up their nose. Now, in these specific cases, it was Gore-Tex, but I know there's things that are silicone Gore-Tex based. But the Gore-Tex became infected. It had to be removed, and they couldn't be put back in, and because of the nose infection, and they became very devastated. They didn't know what to do with regards to having the bridge, building up the bridge. Can you elaborate on what's a good idea? What's the ratio of infection and so forth and so on that?
So basically, in building the bridge of the nose, for an individual as a collapsed bridge, or for ethnic individual, Asians, African Americans, Hispanics who have very shallow bridges, or for revision cases where you need to structurally support the nose, you have three options. You have your own cartilage, you have Gore-Tex which is called an alloplast, which is not your own body tissue, and you have a choice of silicone, which is also an alloplast that is not your own tissue. Anytime you use alloplastic materials such as Gore-Tex and silicone, the chance of infection exists. Now, how high that risk of infection depends on the situation. If, for example, there's a complex reconstruction that has, at the time of surgery, little tears along the septum or other areas, the chance of infection with these alloplastic materials go up. In Caucasians, generally, not always, the chance of infection goes up. In primary cases, for example, in Asian rhinoplasty, which silicone is very commonly used, the chance of infection are low. Regardless, there's a chance of infection. So at least in my practice, I try not to use alloplastic materials if possible. Now, there are cases where the patients don't want to utilize rib cartilage, the patients don't want to utilize any other incisions on their body, or they don't have enough cartilage, then we'll use it, we'll explain it to the patients and so forth. But in general, I try not to use alloplastic material because of that. And I would say on a monthly basis, there's at least one patient that I see in a revisional situation that will require their existing implant to be removed and a rib graft or cartilage graft to be placed in. So the important thing is, in cases that patients have very complex surgery, it's probably best not to use these alloplastic materials. In cases such as primary rhinoplasty, especially in the ethnic population such as Asians, African Americans, patients do quite well with silicone and so forth. But you got to understand that thousands and thousands and thousands of these situations are being performed every day. And the patients that are getting infected are very, very low. However, they do have a very complex and difficult problem to deal with. So it's just the surgeon who's performing this needs to be very vigilant, and any issues that are coming up, the patient needs to let their surgeon know so that it could get resolved immediately and not wait for it to become a bigger problem.
Okay. Getting injections in the nose. One of the people that emailed their website and ended up getting an infection in their Gore-Tex. This gentleman was concerned that he was getting injections in his nose, in the bridge of his nose and in the tip with cortisone or I'm not specifically sure if they're catalog. So, could that have contributed, getting injections, having foreign things injected into your nose? Can that contribute can that bring on an infection? Is it possible?
It is possible. I think anytime you're sticking a needle near a foreign object in the body, I think that there's increases the chance of infection, albeit I bet very, very low risk. But I'm sure if you do 1,000 patients who have implants in their nose and you inject near them, I'm sure one may end up getting infected. as a result of it. So there is a possibility, albeit very, very slim.
Two quick questions on that. One, if somebody has gotten an infection, can they at a later date re-put the Gore-Tex back into the bridge or
My recommendation is if someone who has had a foreign object, such as Gore-Tex or silicone, have had that be infected, I would not recommend replacing it with new Gore-Tex or new silicone. You really, at that point, need to go to an autologous cartilage. That means your own cartilage, either rib, ear, septum, whatever that is required for that issue. So I would highly recommend against going back and putting another situation. And usually my recommendation is always separate out the operation. Take the infected implant out, wait, let it cool off, then put in the new tissue so that you really get a very, very, very good outcome.
Okay. Now, this is a little bit of a fun question. You mentioned earlier that you had performed surgeries on, I mean, you're in Beverly Hills, so of course I'm sure that a lot of the people that come in here are probably models or actresses or want to be. Is there, can you tell us any celebrities or any that you've operated on?
No, I wish I could.
Okay.
I mean, of course, patient confidentiality is number one. And it's important. I mean, there's some patients that go and talk about, their experiences, and once that happens, obviously, it's more appropriate to comment on it. But patient confidentiality is extremely important, and ethically, you really don't want your surgeons to be telling other people about your surgeries.
Well, let's get back to a serious question. How important is it to go to the right doctor the first time? I mean, I know that over the years we've had visitors to our website who went to a ear, through nose and throat doctor, who just was an ear, nose and throat doctor and had the license to perform rhinoplasty, and they thought that was good enough. But I guess my question is rhinoplasty being one of the hardest procedures, how important is it to go to the right surgeon the first time?
Well, I think that it is extremely important to pick your surgeon. This is your face, your nose that you're talking about. These are changes that are going to occur lifelong, that if there's an issue with it, it's going to cost twice or three times as much to correct. Myself, I kind of had a broken nose when I was a kid, and we couldn't afford to. My parents couldn't afford for me to have surgery with kind of one of the top-notch doctors. I waited until I was in medical school, and I ended up having the surgery with the right doctor. And for me, it was more important to wait and have the right surgeon do it than to go to someone who was less qualified or didn't have the aesthetic eye or the expertise that I was looking for. Now, going back to your question about an ear, nose, throat doctor or plastic surgeon or facial plastic surgeon that can perform rhinoplasty procedure, it really doesn't matter what your surgeons, as long as they're either ear, nose, throat, otolaryngology board certified, facial plastic surgery board certified, or plastic surgery board certified. Any of those three specialists can perform rhinoplasty. There are plastic surgeons that don't do one rhinoplasty a year, and there are ENT doctors that do one rhinoplasty a year. There are ENT surgeons that do hundreds of rhinoplasty surgeries a year, and there are plastic surgeons that do hundreds of rhinoplasties a year. The most important thing is that your surgeon performs a lot of these operations and that their aesthetic goal is the same as yours. Because even someone who performs hundreds and hundreds of these operations a year may not have the same aesthetic eye that you want for your nose. And furthermore, are they safe surgeons? Do they perform it at accredited facilities? Do they really sit down and care about what your concerns are? These are all very, very important. So make sure that they're board certified in plastic surgery, facial plastic surgery, or otolaryngology, and make sure that they perform a lot of these operations. Make sure they listen to you and look at their before and afters, because at the end of the day, most surgeons will put what they think is their best before and afters out on their waiting tables. So those are the important things.